You have just analysed and diagnosed a condition of your new patient's blood cells called AML, acute myeloid leukemia. What will be the first things you will say to your new patient?
You came to see me today feeling tired and in general not feeling well. I'm glad you visited your general practice physician who ran general blood tests and told you to visit me today. I'm an oncologist trained in blood disorders. I first checked your overall condition, your heart, your lungs seem to be okay. So then we did a more detailed analysis of your blood, and you have a blood cell mutation, meaning something is not correct. And that is the cause of your not feeling well. It is a blood cancer of your white blood cells, and it is called leukemia. And your type of leukemia is called AML, or acute myeloid leukemia, which means fast growing.
Now that you have heard this news from this doctor, what are the first things that are going through your mind?
We both heard what you said, but cancer news are devastating news to hear, and I feel very confused. I'm very afraid, and I do not know what this means for me. Will this condition make me very sick? Will I be in the hospital? Is there a treatment or a cure? Will I die from this cancer? Is my life as I know it over?
Now that you have heard the patient's first reaction to your news about AML, acute myeloid leukemia, how will you respond to his fears and questions?
You are right. This is very unexpected and difficult news for you to hear, and your questions are all understandable. Until about 10 years ago, AML was very difficult to treat, but recently there have been major advances in how we do detailed diagnoses and maybe match your actual blood changes to new treatments designed specifically for you. This is our first meeting, and I have already started the process of getting a more detailed analysis of your blood condition called your blood mutation. Once we have that information in just a few days, we will better know how to start treating your leukemia. But yes, this will certainly change your life for the next month or two, and perhaps longer.
Do you feel, after the doctor explained what will happen next, that you know what to expect?
I heard the doctor, and I know he will run more tests and figure out my best treatment. Now that this is sinking in, I'm even more confused and fearful. I know he's a skilled oncologist, but should I get a second opinion elsewhere? How and where will I be treated? Will I be in the hospital, at home? How will I pay for this? How will I take care of my family, continue to work? Will I be in a wheelchair soon? He did not even answer the question about whether will I die from this cancer.
You can see the patient is getting more fearful and is confused about what he is actually facing in his life. His mind is racing and he does not know how his next days, weeks and years will be. What would you tell him about a second opinion?
I do understand your concerns and questions, and I will try to answer them for you. Yes, the next few days and weeks for you will be different from your normal life before your white blood cells started to change or mutate. As I mentioned, your treatment and your long-term prognosis may depend on which mutation you have. No matter what we find, I do advise you, as I do with all my patients, to get your personal affairs in order. I know this is a very difficult time for you, but I also want to tell you there is hope, and we have patients who have had successful treatments. I will tell you more at our next visit in 3 days. I do feel a second opinion is a very good idea, and if you'd like, I can recommend 2 large teaching hospitals with AML specialists that might see you right away. It is possible, if they are not within traveling distance, that I can send them blood cell test results and we can connect them with a phone or video call.
As the news about your acute leukemia cancer becomes more clear, what else do you want to say to him or ask him?
I understand what you said about getting my affairs in order, and I will do that. I'm still very fearful right now, but I did hear you say my prognosis and treatment will depend on our next visit in 3 days. I do not know if there is hope for me, so we will go home and try to calm down a little and think about what this visit today. When we have our second meeting, I hope you can help me understand our potential for treatment. And I will bring more questions about my life prognosis, treatment locations, and how things will happen in the next month or two. How we can pay for all this. Yes, please help me set up the second opinion, personally or via remote connection. You said it was a fast-growing cancer, so we are on a very tight schedule.
Now that you are about to end the first meeting with this patient, he seems to have accepted your words about the possibility of a successful treatment depending on his mutation testing. What will you tell him about his questions and schedule?
It might be a good idea to go home and discuss this with family and friends. And I also suggest you do some research and ask friends and your regular physician about a second opinion. There is no way I can determine your mutation type until I receive the analysis. But there is some possibility you have a mutation that has new, successful, personalized treatments available.
This first meeting with the oncologist might seem like a start of terrible times for you and your family. What do you feel now as you leave this first meeting?
I feel confused and scared and do not know if I should have any hope. But I will go home, wait for the second visit and try to calm down. Try to reach out to people and doctors for help and schedule that second opinion. After such devastating news, maybe I can remember the doctor's words that with some luck my mutation will be one for which there are new, hopeful treatments. But as each minute goes by, I have hundreds of questions about why I have these mutations, how we deal with or share this news, and what the future holds.